Our next story starts with images that some people find hard to look at. A child with a cleft palate. Now, in most parts of the world, this is a birth defect that's taken care of in the first few years of life. But in some parts of Africa, the surgical skill necessary is in short supply. Dr. Richard Hopper and his team at the Seattle Children's Craniofacial Center visited Africa a number of times and come up with a great innovation. It's called a PACT Retractor. Lori Matsukawa has the story.
The chance of having a cleft palate in Africa is roughly the same as having a cleft palate in North America. Originally, we didn't think that it was as common, but what people and the African researchers are starting to realize is there's probably a lot of babies that either don't survive because of the cleft palate or are not supported to survive.
Children born with a cleft palate or lip face a cascade of problems. The most urgent, not being able to eat or drink enough. But in Africa, families often travel many miles to get only limited medical care. There just aren't enough doctors. Which is why Seattle Children's partnered with the Komfo Anokye Teaching Hospital in Ghana to form PACT, Partners in African Cleft Training. Since 2007, Seattle Children's craniofacial teams have traveled to Ghana, Ethiopia, and Nigeria to treat cleft lip and palate and have trained more than 90 African surgeons from 7 different nations.
We found that one of the greatest needs was to train surgeons in doing cleft palate surgery. It's a very technically difficult surgery, and you need to have a lot of education before you can do it safely.
When Dr. Hopper sees a problem, he begins to look for answers. He has a reputation for getting things done. Just ask the family of 9-year-old Hannah Scow from Idaho. Hannah was born with Treacher-Collins disease, which had restricted Hannah's breathing from birth. To help Hannah and other children, Dr. Hopper developed and performed a breakthrough surgery that allowed her facial bone structure to slowly pivot forward, growing new bone along the way that would clear a path so she could breathe naturally.
My role was to try to find a device that would be able to let an African surgeon or a surgeon in Africa do a cleft palate surgery safely with all the needs that a surgeon in North America would have.
That device is called a retractor, and it can be very expensive. In fact, Dr. Hopper says in Africa, you can walk into any hospital and find a room filled with expensive equipment that just doesn't work because it's missing a battery or a fuse or a light bulb, making all that expensive equipment worthless. Dr. Hopper knew that if he wanted to make a difference, he had to find something that was easy to fix, inexpensive, and very accessible.
The first idea I came up with was just the pattern. It's almost like a hashtag for Twitter that can open up in all different areas. So you can have it opening this way, and you can have it opening up this way.
The retractor would be placed in the mouth of the child and be able to retract the cheeks, tongue, and gums, opening the mouth wide.
And then also for the trainees to see what you're doing. And that's where the PACT retractor came into play.
During cleft surgery, it's difficult to get near the patient. There's usually only enough room for the surgeon and those assisting. This makes it difficult for trainees to get close enough to see inside the child's tiny mouth. So, Dr. Hopper's team decided to attach a camera to the retractor so the trainees could watch.
We started with using the technology that is available in our operating rooms, endoscopes and different scopes, but they're hundreds of thousands of dollars and completely unrealistic.
Dr. Hopper's team looked for a cheaper alternative, and they found it.
Anytime somebody wants to, for example, look behind a computer and try to check a serial number, the engineers will use a boroscope, so it's something that's designed to be working in the field, something that's designed to be strong and rugged.
The boroscope became the perfect partner for the new PACT retractor and able to transmit the camera's picture to surgical trainees to watch and record on their smartphones or tablets via Wi-Fi.
This retractor, even though it's quite a small piece of metal, it doesn't seem like a big deal, but what it does to the African team is it creates a level of energy and teamwork that can be built around this device. So when you see the African surgeons use this and the trainees see this, you can just feel the energy in the room.
Dr. Hopper says the life of a surgeon in Africa is extremely difficult. Their life expectancy is actually lower than the life expectancy of the average population in Africa because of the long hours, stress, and poor working environment. So to create something that makes their job just a little bit easier gives a needed boost to the medical teams and better results for the kids.
It took us almost 10 years not to develop the device, but to really learn from our African friends what the African teams and the African surgeons need and what would work in Africa.
Dr. Hopper says he could never develop something like the PACT Retractor in isolation. It took the shared energy and resources of Seattle Children's craniofacial program to take an idea and run with it.
I have to say, even the pictures that we're getting from this scope now to train people is better than we've ever been able to achieve in North America. So you'll be seeing me in Seattle using this device quite a bit.